Hassan Mubarak from Auckland Regenerative Clinic, arthritis specialist with a special interest in sport medicine. Today I'll give you a lecture about stem cell therapy. It's a form of regenerative medicine designed to repair damaged cells within the body by reducing inflammation and modulating the immune system. The singularity makes stem cell therapy a viable treatment option for a variety of medical conditions like osteoarthritis, which is a wear and tear process as we age, or it could happen secondary to previous injuries. Various musculoskeletal injuries can be also treated with stem cell therapy. And is the standard treatment these days is autologous expanded stem cell therapy, in which the patient's own cells harvested from the abdominal fat or other areas, and it goes under series of specialized laboratory processes for 6 weeks or longer, depends on the number of cells required, and the process is purification with the sterilization and expansion of the cells to high numbers, and then reimplanted on the day of the injections, together with your own platelet-rich plasma, which has the growth factors. How does the stem cell therapy work? Stem cells are non-specialized cells, but have the ability to replicate and multiply to daughter cells. And they have also the capability of differentiating to various specialized cells like cartilage, muscles, and tendon cells, and others. This process of repair and multiplication happen in the whole first year following the implantation of the cells in a particular area, and it causes effect for many years. How long does it take for stem cell therapy to start working? As the process of degeneration takes many years, so this process of repair also a slow process, which you will not see an effect immediately following the implantation of the cells, but it takes up to 1 month before you can see any effect, and in some cases can take many months before you see the final effect and judgment of the treatment, if it is effective or not. And a lot of issues about the safety from the people, but it's we found it's a safe treatment as it is autologous type of therapy. This means your own cells, so it's very less likely to cause any rejection or any cancer. Particularly studies done over 10,000 population and found no harm. And at the end, it's basically we have to have effective treatment but cause no harm. Sometimes we need to avoid stem cell therapy, and that goes with the consultation. We judge the benefit and risk of the therapy, and any personal history of active cancer, including skin cancer, within the last 5 years, it's the best to avoid the therapy because it can stimulate the cancer cells, and it's occasionally in a localized skin cancer like basal cell carcinoma, when it's a clear margin taking off and is no invasion of the deep tissues, it can still be used. The other avoidance is during a pregnancy, and also is we try to avoid this therapy when it is bone on bone, because it makes it less effective, and in that case surgical option is the best way to go. And in terms of the therapy aim, it has been shown in various studies, and in our clinic is effective in up to 80% or higher of the patients that we have done. And this means that is if we treat 100 patients, we can achieve the target in 80% of the cases. The target is to control the symptoms, including pain and stiffness, and also improving the joint mobility and range of motion. Additionally, improving the quality of life and return to exercise and your loved sport. The idea of this therapy is to slow the progression of the degenerative process, and in its good effect to stop that process. People ask about this is if this is an alternative to surgery. The answer to that is basically this is just another modality of treatment that is accepted in New Zealand to give a freedom of choices to patients which are doing nothing. Conservative treatment like anti-inflammatory medication and physiotherapy. Alternative herbal treatment like glucosamine and chondroitin, or regenerative therapy, including platelet-rich plasma and stem cell therapy, or the choice of the patient to go directly to surgery. And in some cases, patients cannot go under general anesthesia due to comorbidity, and towards the end is always patient choice. And if this regenerative therapy fails, then you can always go for surgery. And lastly, is it worth repeating the injections? The answer to that is in most cases is we do it once, and this should be effective, but you allow to store the cells for up to 15 years in our specialized lab, and this can be for the cells can be injected again in either the same area, or if you develop other areas of injury or wear and tear, and that also can be done without the process of repeating the fat harvesting. And also this can keep the cells at a younger age, and there's no limitation of repeating injections, and this will not endanger the go for a surgical option if that is necessary. Thank you very much.